And joining us now, Dr. Robert Murphy. He is a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning.
Good morning.
Why don't you start by giving us your thoughts on these updated boosters?
Well, this is really great news. We've been waiting for this for quite a while, and the rumors have been flying like this wasn't going to happen until December. And it's very good news that it's happening in September, in mid-September most likely. So apparently they've cleared the pathway for both Moderna and Pfizer to come out with these Omicron vaccines. So this is really incredible news. What's a little bit unusual is that it's still going, these boosters are only going to be for people 50 and older or people that have underlying medical problems. The approach to give everybody a booster was actually voted down by the FDA and the CDC, although Dr. Fauci and Dr. Jha wanted everybody to be able to get the booster, but that is not going to be allowed.
I didn't realize that was part of the equation. So if you're under 50 and looking into the fall or around Christmas time, would you recommend maybe getting a booster of the original? Once that's if that ends up being approved?
You're not eligible for another booster anyway.
Yeah.
Yeah, and so, this is like, I don't understand, the whole thing with the boosters is it prevents severe disease.
Yeah.
People under 50 can still have severe disease. I mean, with the flu shots, we don't just limit it, we give it to everybody. So I don't understand, but the good news is that the new vaccines will be out there
So when do you think that when people under 50 will start getting booster shots? It's not going to happen in September.
Like the big mystery here, we have this very Byzantine system. We've got the NIH and scientists making recommendations. We have the White House making recommendations. We've got the CDC making recommendations, and we have the FDA kind of ruling everything. In a pandemic, this kind of system is a little bit cumbersome.
Let's talk about the current booster that's out right now. So we're seeing with Omicron that it maybe is not preventing it's not preventing respiratory infection, but it is preventing severe infection. We saw this with President Biden, with Governor Pritzker.
Mm-hmm. That's Lauren, great case, especially the Biden case.
Yeah.
79 years old, the guy is double boosted, and he took Paxlovid as well. Don't forget, the guy had a really mild case. This is that's really good news. So we know that we can beat this thing. So you sort of touched on it. There's two phases of COVID. There's the upper respiratory part, and then there's the lower respiratory part, or pneumonia, the severe one, the thing that kills you or gets you in the hospital. And the vaccines actually are very good at preventing the pneumonia.
Mask mandates, they're coming back to some states, back in California, even Georgia and Tennessee. Do you think mask mandates have a chance of returning in Illinois?
Yeah, they do. They could. It all depends on the numbers. Now, I think what's going to happen is that because other places in the world that got Omicron first, their cases are dropping off. You look in South Africa now, there's hardly any cases. All right. We are plateauing, as you've heard. And so I think by the time school starts, those cases really will be coming down. All these waves, since the beginning, they all have a big uptick, a plateau, and going down. We're at the plateau. So in the next month or so, we should start seeing it go down. So I kind of think the mask mandates are not going to come back on this wave.
Dr. Murphy, about monkeypox, we're seeing cases in pregnant women in the United States, a very small number, but it has happened.
It's happened. Yes, it has. And fortunately, the mother and the baby have done very well. And so, we'll see. Pregnant women, that's the big risk. And so, this whole monkeypox thing is likely to spread out of the MSM community and can get into other populations. And that's what we don't want to see.
All right, Dr. Murphy still answers COVID-19 questions Tuesdays on Northwestern University's Institute for Global Health Facebook page. You can also submit questions by Facebook message or via email. There's his information there on the screen. Dr. Murphy, always nice to talk to you. Appreciate your perspective this morning. Thank you.
Have a good weekend.
You too.
You too.
Good morning.
Hey, guys.